Hello, everybody. Thanks for joining us at GenUX with our Intrinsic Data series. Today, we're talking to Jessica Cortez about TBI, traumatic brain injury, how she got into it, what's interesting about it, and how she has found throughout her career that things adjust and change over time, and how she's pivoted and changed over time to match those changes. So, Jessica, welcome.
Thank you very much for having me. I'm excited to be here today.
We are so excited to have you. So, tell us a little bit about yourself.
Okay, well, I am a speech language pathologist, or people know that better as a speech therapist, and I'm also a certified brain injury specialist. And so, a lot of people think when they think speech therapy, they think of like kindergartners saying their R's and S's. And we help with that. That's definitely one thing that we do, but we wear very many hats, and a lot of people don't know that. So I really haven't worked with kindergartners in a very long time. But we do a speech language pathologist. We treat vocal issues, swallowing disorders, and a lot of things we do. And what I focus my whole career on is acquired brain injuries. Okay. So that's always been my passion. And I kind of continued on with my learning. And that's why I became a certified brain injury specialist, just because I love the brain and I wanted to learn more. And so that's where my passion lies. So I'm very happy. I love what I do, and it doesn't feel like I'm working when I'm working.
Awesome. So, why are you attracted to this specific field? I know you love it, but what is it that really stands out for you?
Well, I love the field of speech language pathology because it is in the medical field, but it's not like a doctor. We are the specialists we always say we are the specialists when it comes from here up, because we really deal with the windpipe, the trachea, the swallowing function, and then we also know a lot about the brain. And I love how in speech language pathology, um, we can have like a really great work-life balance. So, and there's so many different places that we can work, and so many different populations that we can work with. One of my greatest mentors told me early on in my career, and she's like, "Well, Jessica, if you get bored with something, just change your work environment, learn something new." And so I have done that, and the result is that you just become much more of a well-rounded therapist, and you can dabble in different environments with different populations, and it's just a lot of fun.
Awesome. So, and the one that you ended up on was traumatic brain injuries. So, how did you end up in that direction as opposed to just, helping people in a different way?
Yes. Well, I've always had this love of the brain ever since I was younger. We had some family members with brain injuries and head and neck cancer. So I've always been drawn to to this population. And I was at the beginning of my career, I was working a lot in the hospitals and long term care. I have a lot of experience in home care and home health. And every time I was able to see someone with a stroke, with a brain injury, I was just so enthralled with how awesome the body is at to recover itself, and how you could take someone that has had something truly horrific happen to them, and when you don't think they're going to survive, but then they do, and they just end up like making all these amazing gains. And so I've really been rewarded. And also with my work with youth, I think it's been very interesting too, seeing how individuals in school, like school age children, how a traumatic brain injury would affect them, and goes on to affect their whole life. So um, the brain has always been so fascinating. So that's why I gravitated towards it. I ended up working in a hospital that only served individuals with an acquired brain injury, that would be a stroke or a traumatic brain injury. And let me kind of
I was going to ask you for the
I'm gonna
definition.
I'm gonna give you the definition. So, not all brain injuries are traumatic, but brain injuries are acquired. So, what is an acquired brain injury? A acquired brain injury is something that happens to the brain after you're born. Okay, you're not born with it. So, an acquired brain injury can be something from internal, like like a stroke, okay? Or it could be something that happens traumatically, something from the it's an outside force to the brain. So basically, so all all brain injuries after you're born are acquired, but not all of them are traumatic.
So like a concussion would be traumatic
Yes,
after like it from a car accident or from maybe a sports situation, like a sports accident, like playing football or baseball, getting hit
correct,
by a ball in the head or something like that.
correct.
Okay.
Yes.
And so I know that you deal with tons of different people, ages like younger to older, all throughout. So what is do you have, is there like a most common traumatic brain injury that you work with, or do you just get tons across the board?
Yes. Well, it's interesting because at different ages, there's more, you're more likely to have a brain injury from a certain activity. Okay. So if we are looking at the ages of, let's say the teenage years, okay, until about age 21, that would be car accidents, sporting accidents. Okay. And then when we get into more of individuals that are of midlife or later, it would still be car accidents, but then also falls when we get into the elderly population, the geriatric population. There are a lot of falls, yes. So primarily, I could treat a baby and I could treat an 106-year-old individual. So it's really kind of cool that I could see all these different ages in what I do.
So you mentioned a little bit about work-life balance, and I mean, I know that you've had an experience because you said you worked in a hospital, but I believe now you have a private practice. So tell me a little bit about your work environment, and how you do your practice and how that has evolved over time.
Yes. So I think when you are working in a hospital system or a long-term care facility or, a rehab facility, it's very much paid for by Medicare, Medicaid. Okay. And because of that, there are lots of different rules that you have to follow. Individuals need to have a certain amount of minutes per day of each therapy discipline. So when you work in a speech therapist would work in the rehab department with physical therapy and occupational therapy. So those three therapies would work together to get enough minutes if it's appropriate for, because not everybody needs all the therapies, but we all work together to get those minutes for those individuals. Okay. And chances are, if you are in one of those facilities, your injury is somewhat more acute and you do need more therapy at that level. Um, However, it comes with some there's some cons, okay? Because it's when you work for a therapy company or a hospital, you're very productivity based, right?
Hmm.
So it's boom, 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 boom. You have this amount of time with this patient, then you have to move on to the other patient. So your days are very calculated. And so that could get very tiring. A lot of therapists get burnt out, especially after COVID. There are a lot of therapists burnt out from being overworked, underpaid, not getting enough time off. And then but then when you're in the outpatient environment, like somewhere where I am now, I get to make my own schedule. I really get to research what's exactly beneficial for my patient. So I like the little bit of it's much better with the work life balance at this stage. Also, when you are working for the man, you have and when individuals are expected to have um, therapy every day, which they need to if their injury is acute. Um, there's no such thing as time off, right? They need therapy. I think 6 days a week is what they aim to provide. So if you would like to take a day off, like as a new therapist, they say, oh, you get lots of days off, you get this much compensation, but it's hard to take days off because there might not be someone to cover you. So when I was a therapist, when I was beginning, in the beginning of my career, I would want to take a day off, but I couldn't. So would go in the Sunday before and work, the Sunday before to make up my minutes, right? Or I would find myself like I remember some days on Thanksgiving going in at 5 in the morning and saying, okay, I got to get my minutes for the day because then if I don't get my minutes, then I can't go have my turkey with my family or I can't take a long weekend. So it gets a little dicey. As well as taking time off for holidays. You got this holiday off. I mean, I witnessed some fights, man, because of it's just a harder environment. And I think people don't realize that we do need to work, we do need to see the patient 6 days a week.
Yeah, with acute. It sounds like the system setting that you were in, which was, the hospital setting, it seems like that deals with more like, I want to say the word profound injuries. Like, so you're working way more. And now with outpatient, could you be working the same with outpatient as you are? I think you're going to talk about outpatient in a second, but like versus what it was. So it sounds like hospital was very time on task and there was like a rigor applied to everything that you were doing. And it was an application based I want to say series or system that rehabilitated a person in a certain way. And it sounds like there's not a lot of wiggle room in the foundational method of this.
No. And I will say, yes, those individuals, they're freshly, I mean, the brain injury must have happened. I mean, they could have been in a car accident or had a massive stroke. And so they start at the acute level, but then they will move on. They will move on so first comes the acute level in the hospital system. Then they will, if it's appropriate, they'll move into a rehabilitative setting. So either a rehab hospital or a long-term care facility that can give them therapy every day if they're still considered moderately to severe. Then they would move into a home health setting where the therapist would come to them multiple days a week. And then once they get a little bit better, then they come into outpatient therapy where they would go once a week, twice a week. Like for speech language pathology, it's usually once or twice a week. Sometimes it's more. So you could be an outpatient 5 days a week. But it depends on a lot of factors like how much help you have at home, and how safe you are at home, whether they will recommend you for that. Yeah.
Okay, so talk to me a little bit more about, you do outpatient now. So when did you decide to pivot to outpatient and kind of like the why? Was it just, you wanted something different? It doesn't have to be anything super crazy. It could just be like, I have 4 kids and that's why I needed to have more freedom. Yeah.
Yes, I really love, so what I'm very passionate about is functional therapy. I really enjoyed my time in home health because I was in the individual's home and we could use their surroundings for therapy. We could go into their kitchen and make a sandwich to work on planning and information processing and memory and reading a recipe. So there's a lot more opportunities for functional therapy. And that's kind of where I pivoted to home health and I was like, oh, this is wonderful. And then now with the work-life balance, yes, I do have a family. And so it does allow me to create my own schedule and it allows me more time to research the areas that I want to research, to read more articles, to gain more knowledge of, and build programming for individuals who need it.
So talk to me about building the program, because when you're in the hospital setting, you said it was like very time-based, time on task. It was very structured in a very specific way. But now that you have a different perspective and a different timeline, you can do research and you can do different things I feel like you might have, it sounded like from how you're describing your previous situation that you have more flexibility for research and to apply different theories. So talk to me a little bit about that.
Yes. So one of the things that I've been researching a lot and building is, so a lot of people don't know that a huge percentage of individuals that are in the justice system have had a traumatic brain injury. And yes, there was a study done by Dr. Kim Gorgans out at the University of Denver a few years back, that said that 76% or above percentage of people that are incarcerated have had at least one traumatic brain injury. And a lot of those individuals are not getting the therapy that they need. Um, and so this is a really big opportunity because we are having these individuals incarcerated, but then when they come out and they enter the general public again, they're more likely to go back to jail because of a symptom of their traumatic brain injury, like poor memory, like they miss their parole, or they can't plan very well, or they are unable to manage their emotions appropriately. So it is a very it's very important that we give these individuals the therapy that they need while they're incarcerated, or to make their transition from being in prison to the general public. We want to get them in that period so that we reduce the recidivism. This is a hard word to say, recidivism, where they for where so they don't go back to jail, right? So that's where my passion is right now. And I'm currently working with some nonprofits in this area to build a program so that we can get into where we need to get into and serve the people that are underserved. Because some of these individuals that come to me, they not only do they have a traumatic brain injury, but they've had a stroke that wasn't addressed because they are underserved, right? So I have a whole host of things that I can treat, but they might not see a doctor, they might not get a referral, the appropriate referrals, they might be sent away when they go to the ER. So we're working on getting a program set up so that we can serve these individuals. And you can't do that with a full-time job at the hospital, right? So you need time to build connections, to make these plans, to research what needs to be done to help these individuals. And so that's where my passion is. And that's also a reason why I've pivoted so that I could do this research to get into what needs to be done, right? In my field.
So talk to me about how you go about doing this research, because that's what we're all about here is data, 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 right? So the study, I think really, like the study that you just quoted or talked about, kind of, I feel like that kind of set something off maybe in you, or maybe it just added to your fire. And then now you're doing more of that. So talk to me about how you're researching that, what different structures that you've applied that you've seen successful in your own practice, maybe other people that you work with. I know that you're working for a nonprofit, so maybe there's other speech therapists and people who are similar to you in that practice doing similar things. So let's talk about that.
Yes. Yeah. Well, it is very interesting. I attended I attended a brain injury symposium, and I saw Dr. Gorgon speak, and afterwards I was like, oh my gosh, this is amazing. How can I help? And I think that's a big thing, is just how can I help? Immediately I was put on this team, as I'm currently the only cognitive therapist on the team to help serve. So we're kind of building this brick by brick and figuring out how to serve these individuals, how to actually get into the prisons, how to connect with doctors to get the referrals, the appropriate referrals that we need. Now, this is very difficult because um, we know for speech language pathologists that actually work in prison hospitals, they even have difficulty working with individuals with swallowing disorders, and swallowing is like, it could be a life or death situation. So if it's hard for them to get in with individuals that need us for swallowing, it's even harder to get through all the red tape to get in with here, to get to work with someone with a traumatic brain injury. Because a traumatic brain injury, a lot of individuals, we kind of say in our field that it's an invisible injury. They are the walking wounded. So you could have a basic conversation and be like, oh, well, he's fine, but he's not, when you kind of get into the nitty gritty of their processing and the memory. So what we have been doing is the individuals that we are serving, we're testing them. We're using some cognitive tests. I use the FAVRES. It's FAVRES.
What's that?
Function. It's a functional executive function standardized test. But it's interesting because it's mainly made for the general public. So when you go to apply something that's primarily made for the general public to someone who has spent more than half their life in a prison environment,
It's a very different
it
population.
is
Yeah.
a very different population. So I really feel like there could be a better test to be developed for these individuals. So how we kind of gather data is more in a functional way, right?
Right.
And is how are they improving in their life? Um, were they able to get their jail time decreased? Were they able to get out of prison? Are they able to hold a job? Are we able to get them into, are they? So, more of what I look at is not like percentages, it's how functional are they in their life situation.
That's interesting. So you're not okay. So because that's a lot of the ways that people who are in psychology measure behavior, right?
Mhm.
So it's just taking it and taking the general idea of standardized tests like the MCMM, I think it's called, or there's personality tests and things like that. And those are based on behaviors. Those are all based on behaviors. So you're also looking at things like intrinsically from behaviors. You're like, well, do you remember to go to your appointments? I feel like you've mentioned that a couple times, like memories have
Mm.
largely impacted. It sounds like, is that something you've noticed? I'm assuming that because you keep saying that, but is that something you've noticed?
Yes, yes, and, when you have, a brain injury, it really, really takes effect on the frontal lobe, so the area of your brain that's right behind your forehead, and that is in charge of our all of our executive functions. It's what makes us human. So, we have the ability to pay attention, the ability to process information, the ability to, remember things, the ability to manage our emotions, the ability to plan and execute a task, the ability to start a task, stop a task. So it really is the gatekeeper, and it's the highest level of brain functioning that's affected. Um, and so that's primarily what I work with. But we always have to remember that in a brain injury, there's so many other things that could be affected, like vision, hearing, walking, your digestive system. There's so many systems at stake because the brain is the head honcho. Um, but primarily in cognitive therapy, we're working on managing emotions. We're working on remembering tasks, planning, math, everything that can help you, um, you know, get a job and be able to take care of a family too.
So have you seen full recoveries in your practice with people?
Yes,
Yeah.
every day. I have some great stories. I had an individual come to me who was the first time that I met him, he was on house arrest. And it was a hard situation because there were so many distractions around him, and he was basically in one little apartment and having to work through all of these issues with the stress of being on house arrest, awaiting a trial. He had a brand new newborn that was he just welcomed his first baby. So I mean that's very stressful, and to work through all of these things. But we worked together. He got off the ankle monitor. He was granted work release. He's now holding down two jobs. He got his prison sentenced. His prison sentence was wiped out. Um, so he's working two jobs to make ends meet for his family, and he's doing very well. So we've seen individuals that are able to have their goals targeted so that they can get out, they can get a job, they can start providing for their family in this in the in the justice system population. And I see it all the time in the general population too. But it's hard because this is a time that a lot of people unfortunately do lose their jobs because they're unable to remember things and to perform in their jobs. But I have seen a lot. I mean, that's why I love what I do because you can see these functional gains.
That's really awesome. I love that.
Mhm.
So, um, we were talking about seeing them over periods of time improve, but are there milestones that, like, when you think of goals and goaling and successful milestones that are hit to see improvement, do you and your patient set up like a kind of a map of what those milestones might be, or do you set them up individually for yourself and not share them until they start to see successes? How do you guys do that?
Well, when I start my evaluation, I am always I always tell my patients, yes, I have 16 years of experience of being a speech therapist, but I have no experience with you. Right? And every single brain is different. So my evaluation process is pretty lengthy and I ask them about everything. I ask about all their body systems. I ask about their job, their family, as well as their attention, their memory, their processing. Um so it's very individualized treatment. And I never set their goals. I talk with them about their goals, right? Because I want them to be functional. Oh, you want to get a job. Okay, that's your goal. Okay, what do we need to do to get you to be able to have a job? We need to have you be able to have a know how to work a calendar. We have to get you making sure you're keeping track of a day planner. We need to make sure you're keeping track of your money. We need to make sure you're paying your rent or you remember when to get your kids from school. And those is that becomes the map of their therapy journey. So it's very patient driven. And then for each individual, there's been a big push, and it's called the Staci Project. Dr. Truska out of Canada. She's been a huge, huge developer of this type of way of targeting goals because we usually have goals, but now we wanted to call them targets. And so each time I see a patient, I give them a little target, and it could be just a very small amount because I want to have them um, feel that sense of pride, that sense of accomplishment. And so I can kind of gauge like, okay, can I give this guy a big target or can I give them, do they need more of a smaller type target for this week? And when we have these little targets that that they're easy to swallow, they're easy to navigate, and you give them to them, then they feel like, okay, I have something to do. I can do this. And when you put that on them, it just makes them feel good because that is a huge part of making your goals is having that self-confidence to do so.
I kind of like the word target a lot more than goal. And here's why. It's like you can almost visualize the red center of like, a dartboard or an archery range or, a gun range or something like that. Like there's a visual aspect to it. And it seems more like I just have to hit the target as opposed to goals can be overwhelming, right? Like the word, it can mean and encompass so many things. So I really like the word target. I like that that's very cool that you guys are changing that word.
Yes, and I think it's better for our patients too. Like you said, it's much better, and it's better as a therapist too. Because if we think about like say a memory strategy, and I'm working with someone to try to remember conversations, and I say, well, at least 2 times this week after you have a conversation with your husband or wife, I want you to summarize what you talked about with them before you go off on your way, and then that person goes home and says, okay, I'm going to do that 2 times. And okay, and I'm going to mark it in my little day planner that I did it. Okay, I did it. And so then they can come and say, well, you know what, Jessica, I did it 2 times and here's the proof and I did this. And so it does make it a lot easier for them to see how they are improving too, because that's a big thing, to have them kind of navigate how far they've come.
That's very cool. I love that. So it sounds like what you do is constantly evolving, and it's really the I want to say the N of one. And for people who don't know what that means, it usually means the research of one person, like the ABCs of me or you, and you kind of map that person,
Yes.
and you use your expertise from other people, but like you said, you have 15 years experience doing this, but you're my first you. So that's really cool. So it's you really do try to custom. What I'm hearing is that you customize the experience and the targets for your patients depending on where they are in space.
hmm
Now, have is that something you came up with on your own, or is that something you've adopted from all the years of experience that you've had?
Well, I think it just comes with the years of experience, I think, and the environment in which I treat. So, if you are a speech language pathologist that works in a hospital at the acute stage, we just want to make sure that the patient can say their name. Like that's what we work on is saying the name or making sure they're paying attention to the right side of the piece of paper. Like that's what we're doing. But for me, I want to know in the outpatient, it kind of gets a little bit fuzzier, right? It's not like, okay, I got to make this person say their name. No, I got to make sure that this individual is performing in their job. So that's why I need to get to know them so much. And I need to know like what their home life is, like how are they sleeping? How are they eating? What's their digestive system like? How they're using the bathroom? Because all of those things, yeah, they're not I'm not like a ear nose and throat doctor. I'm not, I'm not those that's not in my scope of practice, but certainly how those symptoms are affecting my patient, that will affect my patient, right? So we got to make sure we get those in order first. And so that's why, um, through my experience, I know that those things need to be targeted too. So if someone comes to me and says, well, I need to get back to work. I need to have a better memory. I need to get a job, but they're only sleeping 2, 3 hours a night and only eating once a day. So we have to go back to the basics of what the brain really needs. And I think that comes through experience and knowing that this is what the brain needs. If we're not covering those bases first, then there's no way we can meet all of these other goals, right?
Exactly, exactly. That's so cool. So, if you were your younger self, or this inspires somebody to go to school and do this, like what's the path? Like, where do they go to school? What is their major? How do they become more like what you're doing right now?
Yes, yeah. So I actually got my Bachelor of Arts in psychology,
Hmm.
and then I went into a program for speech language pathology. So you have to have your master's to become a speech language pathologist, but you can become a speech therapy assistant, but they're not as common, especially not in this part of the United States. So you really want to make sure you get into a program. They are very it's very competitive. It's very competitive to get into a master's program. So you really want to make sure that you do everything you can, you keep your grades up, everything. And then once you get into a master's program, then you get credentialed. You have to take the national exam. You have to get your certificate of clinical competency, and then you're a speech therapist, and then you can go into any environment that you want. And then if you feel bored in one environment, then you can like for me, I was working in the schools, I was working in the hospital, but I said, okay, I want to change my population. Then you can do that, and it's so great that I just love my field so much and how much opportunity there is there.
All right, now looking back, I know this is another like looking back question, but do you think that starting in the school districts, the schools and the hospitals was like a really good education, and then going out on your own later was even better? Like I know there's people who are like, when I was young, I was like, I started a business. I didn't know what I was doing, but I also wasn't treating people with traumatic brain injuries. So, I mean, if you were 20 and you were going through this path, like what would you suggest somebody to do to learn the types of skills that you have? Would you just be like, go out off on your own to start, or where would you tell them to go?
I really I call it my time in the trenches. All the time that I was in the long-term care facilities, I was in the hospitals. Even though it was hard, I learned so much from being around some incredible therapists, and you can't really get that if you're out on your own, right? So I would definitely say get all the experience and work in any environment that you can. And that's why I dabbled so much in the younger years of my profession, that's why I dabbled, because I learned from doctors, I learned from nurses, I learned from other therapists, I learned from teachers, and I got to see a range of different kinds of environments and different kinds of individuals and different diagnoses.
Right.
And when you have that experience under your belt, then you're better able, you got the muscles behind you to have any situation, because literally I do not know who's going to walk through my door, right? And so I'm counting on those years of experience to help me in my clinical decision making.
That's amazing. I love
For
that.
sure. Yeah.
So, if somebody needed to contact you after they saw this, how would they contact you? What are you working on? Tell us everything that you have going on right now.
Yes, yes. I have a website. It's theloomconnection.com. And I'm also on Instagram, and my little handle is the Loom Connection. And I am working in Denver to set up a program that will help individuals who are in the justice system and also the underserved have the ability to access cognitive therapy, counseling services. We're in the nitty gritty of that right now.
Are you working with any grad programs or grad students on that?
No, not now, but in the future, I'm sure that there's going to be opportunities. I do know that we work with some graduate students from the University of Denver with Dr. Kim Gorgons. She's a part of our program, so I know some individuals do work with her on with us with that. So yes, I'm very passionate about this. I think it's a really big need, because in my field, we just have to find where the gaps are and see how we can fill the gaps. And I think this is a really big opportunity for speech language pathologists to provide care that for people who are not getting the care that they need and deserve.
That's true. That's very true. And sometimes they don't even know that they need it, it seems like. From
Yes.
what you're saying, like they don't know that the reason they're forgetting something is because of whatever traumatic brain injury they did have that wasn't treated. They
Yes,
don't
and
know
that's
the same.
that's very true. I mean, I can't tell you how many people come to me, and within the first in our evaluation, they just start bawling because they thought this was all in their head, and that these issues that they're having are just, people are like, well, before the accident you were fine, but now after the accident you're like crazy in the head, and you're like, no, I'm not. I know there's something wrong. So it's very validating. It's very validating for that person when they first talk to someone like me to be like, no, you're not imagining it. And there is hope, and there is a lot of hope for individuals. Yeah.
Awesome. I love that. So, there you have it. This is what it sounds like to be a speech pathologist working in multiple different industries throughout her career and where she landed. If you are interested, you should definitely talk to Jessica, or if you're interested in the field, now you have a little bit more information. But Jessica, thank you so much for being on the show today. I loved having you on. And she also has a LinkedIn profile, and she's going to be
Yes.
posting this too.
LinkedIn. Yes, I do.
So we'll have all that stuff below. And thanks for joining us at GenUX Intrinsic Data. Have a great day.
Thank you so much. Bye bye.